Good day to all the students. This is a video on glomerular filtration rate. In this video, I am going to talk about the determinants of GFR. Determinants means the main factors which affect the glomerular filtration rate. As you know, GFR or glomerular filtration rate is one of the most important indices of renal function. We will be discussing it here, mainly the main factors which determine the glomerular filtration rate. You can see here there is a capillary plexus. This is a tuft of capillaries, a ball of capillaries. These are known as glomerular capillaries. And one arteriole comes in from the renal artery into this. This is known as the efferent arteriole. Efferent means incoming. One arteriole leaves it. It is known as the efferent. Efferent means going out. And this efferent arteriole eventually leads to the peritubular capillaries. The main function of the kidney is to filter this fluid from the across the glomerular capillaries into the Bowman space, and this is known as glomerular filtration. Glomerular filtration is the process by which fluid is filtered across the glomerular capillaries into the Bowman space. The glomerular capillaries are three-layered. It has an epithelium, a basement membrane, and an endothelium. When fluid is filtered across these three layers into the Bowman's capsule, then it is known as glomerular filtration. While urine is formed, eventually urine is formed, and this urine, before this urine is formed, some fluid is reabsorbed. You can say reabsorbed because absorption occurs in the intestines. When it is filtered by the kidneys and absorbed again, it is called reabsorbed. Some fluid, some substances pass from the peritubular capillaries into the renal tubule, and this is known as secretion. When substances pass in the opposite direction from the peritubular capillaries into the renal tubule, then it is known as secretion. So substances like potassium and hydrogen ions and creatinine are secreted. Which substances are reabsorbed? Sodium, potassium, chloride, glucose, amino acids are reabsorbed. Now, glomerular filtration is the first step in urine formation. The formation of urine, glomerular filtration is the first step. Which are other two steps? The other two steps are, you can see this, that is tubular reabsorption and tubular secretion. The rate at which the fluid is filtered. The rate at which the fluid is filtered across the basement membrane and the endothelium into the Bowman space is called glomerular filtration rate. The rate at which fluid is filtered across the glomerular capillaries into the Bowman space is known as glomerular filtration rate or GFR, and it is a very important index of renal function. You know, when renal function is measured, the GFR is measured, the serum creatinine is measured, and that gives an idea about the GFR. Its normal value is 125 ml per minute. But 125 ml per minute is not the urine form. Urine formed is 1 ml per minute only. So 124 ml per minute is reabsorbed. The filtration, glomerular filtration rate is 125 ml per minute. That is the amount of glomerular filtrate formed each minute by all the nephrons of both the kidneys is 125 ml per minute. It comes down to 180 liters per day. We need to remember two terms, 125 ml per minute and 180 liters per day. So the entire plasma is filtered by the kidneys 36 times a day. One should wonder why such the kidney does such an enormous task. Why the kidney works so hard and filters the plasma 36 times a day. This I'll answer in the next video. Glomerular filtration rate is determined by these forces, are known as Starling's forces, after Professor Ernest Henry Starling, who described them. Starling described the first hormone, secretin, and these forces are of two types. These forces are of two types. They are hydrostatic and osmotic. The hydrostatic, as you can see here, is derived from the pressure of the blood. So the capillary hydrostatic pressure, which promotes filtration, is derived from the pressure of the blood. And the osmotic pressure, which opposes filtration, is derived from the concentration of the plasma proteins. This is in the capillary. Opposite forces act in the interstitium, in the space surrounding the capillaries. This is the interstitium. So there is the capillary hydrostatic pressure which promotes filtration. There is the capillary osmotic pressure which opposes filtration. Normally the hydrostatic pressure is slightly high, so filtration is promoted. Then there are similar forces in the interstitial hydrostatic pressure which opposes filtration, and the interstitial osmotic pressure which promotes filtration. Slightly confusing. We are concerned about the pressures in the capillary mainly, and they are the capillary hydrostatic pressure which promotes filtration, and the capillary oncotic pressure, or the capillary or the pressure due to the plasma proteins which opposes filtration. If the plasma protein concentration becomes very low, as when the kidney loses a large amount of proteins, as in nephrotic syndrome, then there is collection of fluid in the interstitium. It is called edema. Collection of fluid in the interstitium is called edema. Or if the hydrostatic pressure becomes very high, it becomes increased. When does that happen? When the heart fails as a pump, there is collection of fluid in the vessels of the body, and fluid oozes out, leading to edema. Now these Starling forces corresponding to the glomerular capillaries. You can see there is the glomerular capillary hydrostatic pressure which promotes filtration. There is a glomerular capillary colloid osmotic pressure which opposes filtration, and there is the Bowman's capsule colloid osmotic hydrostatic pressure which opposes filtration. The main one is the glomerular capillary hydrostatic pressure, this one. So if we say this is the capillary, glomerular capillary, and this is the Bowman's capsule, then the glomerular capillary hydrostatic pressure is the main one which promotes filtration. Then the glomerular colloid osmotic pressure, or the glomerular pressure due to the plasma proteins, which will oppose filtration. Naturally, the proteins hold fluid like a gel. But there is some pressure in the interstitium which is opposing filtration, and that is the Bowman's capsule hydrostatic pressure. So this pressure is 60, 60. This is 32. So this is negative, and still one more negative is in the interstitium is 18. That is the Bowman's capsule hydrostatic pressure. So the net pressure is 10 millimeters of mercury. Net filtering pressure is 10 millimeters of mercury, and the filtration coefficient, that is the permeability and surface area of the glomerular capillaries, is 12.5 millimeters of mercury, so it is 125 ml per minute. GFR is 125 ml per minute or 180 liters per day. We'll describe these forces one by one. First, we come to the Bowman's capsule hydrostatic pressure. What does it correspond to? It corresponds to the hydrostatic pressure in the interstitium surrounding the capillary. So it opposes filtration. So it has a negative connotation. So it negatively affects the GFR. But please remember, the body has formed it in such a way that it is not the primary determinant of GFR, not the primary determinant. So if a stone lodges and it increases, it can increase, and it opposes filtration. This is a renal stone which can be 2-3 inches or a few centimeters. This is a few centimeters. This stone is very big, ureteric stone, renal stone, and it opposes filtration, and then it can cause damage to the kidneys. So the Bowman's capsule hydrostatic pressure, normal value is 18 millimeters of mercury. It negatively affects GFR, and please remember, it is not a primary determinant. When there is lodgement of calculi or stone in the urinary tract, it increases, it opposes filtration, and thereby it can cause damage to the kidneys. The colloid osmotic pressure in the glomerular capillaries. Again, it is a negative pressure. Colloid osmotic pressure is due to the plasma proteins. It is a negative one. It opposes filtration. Negative means it opposes filtration, and it is not a primary determinant of GFR, not a primary determinant. So severe constriction of the efferent arteriole, if it occurs when angiotensin 2 increases more than 3 times, it increases the colloid osmotic pressure and it decreases the GFR. Angiotensin 2 can cause severe constriction of this arteriole, which is the arteriole, the efferent arteriole, which goes away from the glomerular capillaries. Now the main hero, the protagonist of the entire orchestra, is the glomerular capillary hydrostatic pressure, and it is the primary determinant of GFR. The glomerular capillary hydrostatic pressure is the primary determinant of GFR. The first thing which affects it is mean blood pressure. But please remember, mean blood pressure is auto-regulated between 70 to 180 millimeters of mercury. So if one stands up from a sitting position, and that is very common, isn't it? So while standing up from a sitting position, there is sympathetic activation, but there is only mild to moderate sympathetic activation, and that does not affect the GFR. While when one loses a large volume of blood, 10% or more, as in hemorrhage, as in road traffic accident, there is severe activation of the sympathetic nervous system, and that reduces the GFR. Again, the efferent arteriolar resistance is one of the factors which determines the glomerular capillary hydrostatic pressure. It is affected by the efferent arteriolar resistance, but it is inversely affected by the efferent arteriolar resistance. When the efferent arteriolar resistance increases, as in hemorrhage, when there is sympathetic nervous system activation, there is release of NE. NE is norepinephrine. It decreases GFR. And if there is a release of nitric oxide and prostaglandins, it increases GFR. Efferent arterial resistance is affected by angiotensin 2, and mild to moderate increases the glomerular capillary hydrostatic pressure, increases GFR, while efferent arterial resistance is greatly increased if angiotensin 2 is increased more than 3 times and increases the glomerular colloid osmotic pressure and decreases the GFR. So it has what is known as this biphasic effect. Biphasic effect means mild to moderate increase in angiotensin 2 increases the glomerular capillary hydrostatic pressure and increases the GFR, while greater than 3 times increases the colloid osmotic pressure and it decreases the GFR. Coming to the take home points, glomerular filtration is the first step in urine formation. It is the first step. It is followed by tubular reabsorption and tubular secretion. And it is the most important index of renal function. It is the most important marker of renal function. Its normal value is 125 ml per minute or 180 liters per day. It is determined by the filtration coefficient and the Starling forces. The filtration coefficient is permeability to surface area and the Starling's forces acting across the glomerular capillary uh, membrane. The hydrostatic pressure in the glomerular capillaries is the main determinant, and it is affected by the mean blood pressure, which is auto-regulated, the efferent arteriolar resistance, which is dependent on sympathetic nervous system activation, and efferent arteriolar resistance, which is determined by angiotensin 2. And finally, the glomerular colloid osmotic pressure and the Bowman's capsule hydrostatic pressure negatively affect the GFR. So thank you to all the students and faculty for patient watching. Have a good day. Enjoy the day. Thank you.